So we proceed to our last talk of this session. Dr. Manushree GAUTAM. She's going to speak on intralesional triamcinolone, a novel technique of management of cicatricial ectropion. Is it still a novel technique?
Good afternoon, everyone. Cicatricial ectropion is caused by vertical shortening or scarring of the anterior lamella. Thermal or chemical burns, mechanical injuries, or surgical trauma can be the causes. Managing is difficult because it needs personalized approach, and correction with transpositional flaps or full thickness skin grafts is a usual technique. But graft retrieval in these cases is challenging, and also the uptake is difficult. Intralesional triamcinolone has been used for reduction of hypertrophic scars and keloids, and recently it's also used in lid malpositions, and it is also used in cicatricial ectropion with other adjuvants. This study is carried out to evaluate the effect of intralesional triamcinolone alone on eyelid scars and in the management of cicatricial ectropion. The purpose of this study was to study the outcome of intralesional triamcinolone for the treatment of cicatricial ectropion and to use objective parameters for monitoring the improvement in patients. It was a prospective interventional study, and 5 patients with lid scarring causing ectropion were included in the study. Those with active infections, history of tuberculosis or active tuberculosis, and immunocompromised patients were excluded. All the patients were given 1 ml of triamcinolone acetonide injection subcutaneously around the scar at the junction of the scarred and unscarred tissue under all aseptic precautions, and it was repeated after every 2 weeks. Minimum of 1 and maximum of up to 3 injections were given. Oral and topical antibiotics were given for support, oral for 3 and topical for 5 days. And at each visit, the patient was evaluated for redness, swelling, inflammation or atrophy, telangiectasias, and pigmentary disturbances. Grade of ectropion, vertical palpebral fissure height, and leg of thalmus were noted. The mean age of these patients was 48.6 years. The follow-up was of 1 year plus minus 2 months. 3 patients had grade 4 ectropion, which decreased to grade 1 after 3 injections. And 2 patients had grade 2 ectropion, which was corrected by 2 injections and 1 injection respectively in each patient. Average palpebral fissure height was 18 millimeter, which was decreased to 12 millimeter. Adequate lid closure could be achieved in all cases, and any residual ectropion was corrected surgically. Pain persisted for 1 or 2 days in few patients. Skin changes, skin breakdown, pigment changes, or infection was not found. Out of the 5 patients, 2 patients needed only Z-plasty. 1 patient required skin graft after 3 injections of triamcinolone, while 2 patients did not need any further surgical correction. Management of cicatricial ectropion is challenging. Horizontal shortening and full thickness skin grafts are the most common surgical options. Different degrees of contracture of grafted skin and adaptation is difficult. So the disadvantages of grafts and skin flaps needs a newer technique. Though not used earlier for cicatricial ectropion alone, intralesional triamcinolone has been used for lower eyelid malpositions. In a recent study, it is also shown as an adjuvant to 5-fluorouracil for scar remodeling. The average number of injections in that study was 5.5, since the injections were given at 4 weekly interval. In our study, since only triamcinolone was used, the injection could be repeated frequently, that is only at 2 week of interval, which decreases the duration of treatment. But further large-scale studies and long-term studies are required. And to summarize, cicatricial ectropion is secondarily to retraction, and successful management depends on preoperative evaluation and personalized treatment, and scar reduction should be considered before definitive surgery.
What was the duration? When did you start? You have very small sample size. And
Ma'am, the post-op of all these patients has been for 1 year, and we are still including all the patients who have cicatricial ectropion who come to our oculoplasty clinic. So those who have completed 1 year of follow-up, only they have been included in the study.
Okay, so what was the duration, I mean, from your diagnosis to the injection? I mean, what was the insult of the...
Ma'am, these patients they were road traffic accident patients, or they were because of radiation therapy, and or they were because of burns. So when the primary condition was settled and the inflammation settled, and there was no active infection involved, then we injected the patient with the
So
Triamcinolone.
roughly what was the duration? I mean,
Usually ranging from 1 month to 3 months post insult.
What was the need of giving oral antibiotics with the injection?
Sir, only prophylactically, since we were giving steroid injections, and since the bed is already a compromised place, so we prophylactically gave antibiotics to prevent any infections.
You didn't think of trying 5-FU along with
Ma'am, we did. After we did the study, we were going through the research review, and we found that there were good results with 5-FU. But only thing is, 5-FU is anti-mitotic, so the duration has to be kept. 3 weeks minimum duration is required. And with tricot in surgery, we had seen that keloids patients, the surgery people are giving even at 4 days and 7 days intervals, and it is drastically reducing the size of keloids. So they were giving such frequently, and there was no adverse effects in those keloid patients, so we thought, why not?
5-FU gives you better results. One, steroids, they cause a bit of hyperpigmentation also. When you give alone steroid, giving it with 5-FU, it reduces that hyperpigmentation also. And steroid injections are more painful than when given in a combination. And or alone 5-FU can also be given. So it is better to give a combination. For next time, try that. It gives you better result, because I have been working on this since long.
Yes.
So it is better that you try a combination.
Yes, ma'am.
Okay, that will give you better results. Because cost-wise also both are equal.
Yes, ma'am.
There is
Cost-wise
no
both
issue
are
of any
equally.
cost. And there is
And ma'am,
nothing
in
like even
reproductive
5-FU
age
can be
and,
given 2 to 4 weekly. ऐसा कुछ नहीं है कि you
even
cannot
2
give.
weekly it can
Yeah,
be given.
we have given 2 weekly
Yes,
also.
ma'am, because the studies which we saw 3 weekly were given, and also we were skeptical about the reproductive age and pregnant and
When you give
lactating.
5-FU and steroids together, you see that immediately after one injection, that softness, that because of that anti-fibrotic effect more of the 5-FU, patient आपको कहेगा कि मुझे वो stretch effect और वो खत्म हो गया, and he is willing for the second injection. So that is much better. हाँ, ठीक है. Thank you.
Thank you, ma'am.